Hello and welcome to another episode of In Good Health with McLaren Macomb. I am your host, Aaliyah Flores, and today we will be speaking with Dr. Patrick Flaherty about a serious public health issue. And then we will take a look at how an organization empowers young ladies. But first, we are here with Dr. Kristopher Weemes to learn more about women's health issues and pregnancy. Hi, Dr. Weems. How are you doing today?
I'm doing great today. How about yourself?
Good. I'm doing great. Could you just share with us a little bit about your background?
So, like I said, my name's Dr. Kristopher Weems. I'm specialize in obstetrics and gynecology at McLaren Macomb Hospital. I have been there for the last year and a half, going on 2 years here. I did my residency there, my training there at McLaren Macomb itself, so I'm very familiar with the area.
Great. And
love being here.
Great. Well, this time of year we see a lot of pregnancies. So could you just tell us, those of us who don't know about being pregnant, how does pregnancy change the body?
Well, whenever I talk to my patients that are, they just found out they were pregnant, there's two aspects of it you have to look at. Mm-hmm. There's the emotional side of it and there's the physical side of it. Mm-hmm. When you're talking the emotional side, when you got hormones that are going crazy, they're elevating, especially in the first trimester, you're going to go through bouts of emotions. You're going to have your highs, you're going to have your lows. You're going to feel like, you're king of the world, and other times you don't want anyone around you and you don't want to talk to anyone. So those are the kind of things you can expect. Now, the physical aspect, obviously, there's going to be some weight gain involved. That's always the first question is, how much weight gain can I expect?
And what does that look about? How much weight usually does a woman gain during her pregnancy?
Well,
that's a safe weight.
A safe weight, it depends on the patient's BMI, mm-hmm. but I usually say, 20 to 25 pounds. That's kind of in the middle. That's a safe weight to kind of go with. Okay. The old expression, I'm eating for two, it's kind of one of those false, misconceptions.
I used it all the time.
Yeah, and it is. It's a very common excuse to, eat and do whatever you want. But, keep in mind, the goal is still, what you eat, your baby gets too. Mm-hmm. So you should still maintain a healthy diet and a healthy lifestyle for you and your baby. Okay. And, don't get lost in the conception that you're eating for two.
So what type of advice would you have for the mothers-to-be during their pregnancy?
Advice, beforehand. Okay. You don't want to go into it blind and then, you get all these things that are unexpected that pop up. So I always say go into your doctor, lay everything out on the table, talk about it, and if you have any history of chronic diseases, illnesses, you want to get everything well controlled before throwing a whole new pregnancy on top of it.
So what might be some diseases that might flare up during a pregnancy?
Pretty much anything, really.
Really? Okay.
I always think of pregnancy as this. It is the ultimate life stress test. So anything that you have pre-existing, it gets ramped up significantly during pregnancy. Even things that you don't have pre-pregnancy, such as diabetes. Okay. Diabetes can flare up during pregnancy, and then it can go away. So I always say pregnancy is almost a mirror into the future, as you would.
So diabetes, perhaps hypertension.
Hypertension, very common, and a lot of younger women, they don't necessarily always see a primary care physician before becoming pregnant. And a lot of these things, they're almost like the silent diseases. Patients don't always know they have it. Mm-hmm. You can't walk around every day and feel hypertension. It's one of those things, you go to a doctor's office, they take your blood pressure, and they tell you have it. So that's why it's important to have preconceptual counseling, so you can figure out these comorbidities, these diseases beforehand, get them treated under control. That way you're prepared for when pregnancy comes in.
And how does that affect the baby?
When you're talking about hypertension specifically, that can cause problem. Think of it this way: you have all your blood vessels, you have the umbilical cord going to the baby. That's its life supply.
Right.
So when you got hypertension, think of someone taking that hose and squeezing it, and it can cause the baby to be on the smaller side, or what we call intrauterine growth restriction. And diabetes and hypertension can actually lead to other pregnancy-related diseases such as preeclampsia. So that's why, like I said, it's important to get those under control so you can avoid getting these other things diagnosed during pregnancy.
So we know that there are a lot of misconceptions about pregnancy. What are some of the misconceptions that you've heard from some of your patients?
The big ones being is, the biggest one I get are patients that come in that have had children before. And then they say, well, this didn't happen this last pregnancy. Why is this happening now? I always say each pregnancy is like rolling the dice. It's a whole new set of issues. It's a whole new set of problems. You have to look at each pregnancy as its own entity. And when you get fixated on this happened last time, you can expect it now, not always. Or this didn't happen before and now it is. Those things happen all the time. So you have to go into it thinking, this is a whole new set of issues and problems I got to deal with.
What should your patients be doing to prepare for pregnancy? Can you give our viewers some advice on that aspect?
There's not much. I always put my patients, if they're not pregnant, I always recommend a prenatal vitamin.
Okay.
Now, people always say, well, I take a multivitamin, is that good enough? The difference between a multivitamin and a prenatal vitamin is the folic acid content. You want that extra folic acid to
And what does that do?
It helps your baby develop, bone developments, neurologic developments, all those good things. Another thing you want in the prenatal vitamin is something called DHA. And what that is it helps neurologic development of your child as well.
Okay.
So you really want to get one of those prenatal vitamins with the DHA to help, make sure that you're growing a healthy baby.
I know this question is a little off topic, but I was just wondering, some women, middle-aged women, need hysterectomies. And what would be your advice for women who might need a partial hysterectomy or a full hysterectomy? What are the benefits of having a hysterectomy?
Well, it depends what you're getting the hysterectomy for. There's various reasons to get a hysterectomy, whether it's pelvic pain, if it's heavy bleeding, abnormal periods, things of that nature.
Okay.
A partial hysterectomy is where you just take the uterus out itself. A full hysterectomy is where you take the ovaries out too. Now, as a gynecologist, we like to keep the ovaries because they produce all the hormones. They prevent you from going through early menopause. Not only that, the estrogen content is good for bone health, to prevent osteoporosis, and it helps the cardiovascular system too, especially in these middle-aged women that need that, benefit. Obviously, hysterectomy is the gold standard for a lot of patients to have done, but I don't want women to have the misconception that's the only treatment out there. We have a lot of other now minimally invasive treatments for bleeding and, fibroids and
What
a
would
lot
some
of
of those
other
treatments
things.
look like?
Well, for bleeding, we do things called endometrial ablations, where we can actually not even creating an incision, and we can go in inside the uterus through the vagina, and we can actually cauterize the lining of the uterus and cure the bleeding just like that. And it's a same-day procedure. You can go in, you leave that day as well, and you don't have to worry about any incisions.
Okay.
Other minimally invasive surgeries, you can actually have those fibroids, actually just the fibroids removed instead of taking the whole uterus. Other things they can do, uterine artery embolization.
Okay.
That is where you can actually go into a radiology department and they can ablate those blood vessels that go into the uterus and shrink those fibroids. And that's a minimally invasive surgery with no incisions whatsoever. So it's what your provider's comfortable with.
Okay.
But if you go in and they strictly say hysterectomy is treatment, there's a lot of other treatment options out there. It just depends what the issue is that's going on.
Okay. Well, you have certainly provided us with a lot of information about pregnancy, before and after, as well as hysterectomies. We appreciate that. Thank you so much for being with us today.
Absolutely, anytime.
Thank you. And now, a beautiful me.
A Beautiful Me has a really unique fundraiser, and it's called an avant-garde hair show, which is extreme artistic hair on everyday women. It's created by Michigan's hairstylists all around the state. We have some hairstylists from Grand Ledge, from Rochester, from Port Huron, from Macomb County, and it's just really a fun time for girls to appreciate who they are, no matter what they look like on the outside, or because it's really the beauties from within. And it's just a lot of fun, and this is our 6th year. A Beautiful Me's purpose, our mission and our vision is to foster self-worth in all women of all ages. Though we focus on 3rd through 12th grade with a pinpoint audience of 5th grade, because a girl's self-worth peaks at age 9, and we don't want to have to continually try to fix women. Instead, we're trying to be proactive with our young girls. A year ago, this girl was in 10th grade, and she raised her hand during the workshop, and she said, "I went through A Beautiful Me in 5th grade at Lakeport Elementary." What really caught me was that we only spend 8 hours with our young girls in our traditional workshop. She then repeated to me some of the things she learned in 5th grade when we spent 8 hours with her. And it really even dropped my jaw, because I just thought, if this is such a powerful curriculum, we want to reach out to as many girls as possible. We had amazing sponsors this year. Our red carpet sponsor is Lear Corporation, and this is their 2nd year sponsoring us. We're very excited to have our BU sponsors, and that is McLaren Macomb. And we're very grateful for McLaren Macomb for that. We have many other sponsors at different levels, and that is really what helps us to be able to provide our workshops to our local girls.
Hi, Dr. Flaherty. How are you doing today?
Good, thanks. How are you?
Good, good. Well, welcome. Thank you for joining us. And if you could just share with our viewers a little bit about your background.
Okay. I'm actually born and raised in Macomb County. I grew up in St. Clair Shores.
Close.
And went to undergraduate at Wayne State University, and did my residency at McLaren Macomb in emergency medicine. And now I've been an attending physician at McLaren Macomb in the emergency department for 8 years now.
Okay, perfect. Well, we hear a lot about abuse with prescription drugs, and you have a great interest in this. Why is that?
I do. Well, you know, having worked in the emergency department for over 8 years now, there's definitely been, I've seen a big increase, unfortunately, of, you know, patients coming in with prescription drug abuse issues, dependency issues, and even overdoses. So, you know, it's more of a frequency. And I think the bigger issue now is you're seeing it in such young patients. It's not uncommon to see it teenagers. You know, in fact, the recent studies show that 1 out of 5 high school kids report misusing prescription drugs. So it's affecting our younger population.
So is there something that you run into more often than others when you're in the emergency department?
Yeah, I think the prescription, you know, patients that are misusing prescription drugs.
Okay.
You know, whether they be provided by a healthcare provider or maybe they got them from family members. It's a very common thing we see.
Okay. So is this something that you see it more in the younger adults than in older adults? Is there a discrepancy, so to speak, in the age group?
It kind of affects all, you know, all ages.
Okay.
But I think it really hits home when you see the younger kid. You know, they're
Right.
so young. Some of them are even in junior high school and are, you know, being exposed to this. So.
And what can lead to this abuse? Is it the kids being able to get the prescription drugs in the home? Is it from friends? Is it on the street?
Yeah, that's a good point. One of the big things we try, you know, increase awareness that 70% of the time they're receiving them from family members. You know, not maybe the family members just have some leftover medications in the house,
Right.
and you know the kids are exposed to that. So.
Okay. So how does this abuse manifest itself physically?
Yeah, what happens is it leads to dependency. The the patients become dependent on these medications, and that leads to tolerance. And when you're tolerant, unfortunately, you acquire more and more of this medication, greater strengths, and then that oftentimes that leads people to look for like street drugs, say heroin, which now is a whole nother major issue. So.
Right. So you're seeing a lot more heroin abuse in the emergency room department
Correct.
now? Okay.
Yep.
Okay.
Heroin abuse and heroin overdoses.
Okay. It just has to be very sad to see
very
people
tough.
come in. Yeah. Yeah, I understand. So what sort of measures are out there that have been to help those people with the addictions? Are there programs that they can reach out to? What can we do to help
Yeah,
those
it's a good question. There are good programs out there. You know, there's support groups like Narcotics Anonymous.
Okay.
In Macomb County, there's Families Against Narcotics. It was actually started in Fraser. It's led by Macomb County Judge Linda Davis.
Okay.
And it's a great support network for those who are affected by addiction. So besides those, you also have physicians that specialize in addiction medication, and they can help assist you with that. There's medical therapies, treatment centers that can assist patients.
Okay. So as parents, is there anything that we can do more or less to make sure that our children's friends are not getting a hold of the drugs in our home? Because we might not even be aware of it.
Correct, and that's the big thing. I was trying to increase awareness. You know, I think if you do receive, say if you had a tooth pulled, you're prescribed some pain medicine, you don't use them all, they're sitting around home, biggest thing is dispose of them.
Okay. And is there anywhere we can dispose of them?
Local police departments,
Okay.
you can dispose your medications, and also some pharmacies.
Okay.
But
They'll
all the
take
local
care.
police departments in Macomb County, you can drop off your medications and dispose
They'll
of them.
take care of them.
Yep.
Okay. So what is being done to help curb the issues with addiction here?
Biggest thing is increase awareness.
Okay.
The U.S. Surgeon General just came out with a report this past week that's comparing it to like smoking back in the 1960s when they increased awareness.
Okay.
Just so people realize that it is an issue. 2014 saw the most overdose deaths ever. So it's so common, such a big epidemic. They just want to increase awareness, make sure people are aware of it, and look for signs. You know, if your child or something may be exposed to these type of medications.
And what signs can we look for?
Well, change of behavior. You know, if they're in high school, maybe their grades are slipping.
Okay.
Things like that, or a new group of friends. Those are some of the telltale signs.
Okay. Well, we certainly appreciate you coming in today and helping our viewers understand a little bit more about addiction and how to help our children or family members out with that problem. Thank you for coming in, and we look forward to talking to you soon.
Thanks for having me.
Okay, thank you. Thank you for watching. We'll see you next time.
To view this episode again, visit mclaren.org/MacombBlog.